Hello folks, Dr. Phillip Yoo, lose a pound a day body weight system I'm going to talk about. Before we were talking about Candida infections and how to test that with the first test, which is saliva test. We got kind of cut off. I was explaining the other test, which is just take a survey of your diet. So basically, if you love these foods right here, breads, rolls, donuts, dairy products, pizza, pasta, fast food, junk food, cola, juice, alcohol, sugar, chocolate, candy, coffee, fruit. You probably most likely have Candida infection because Candida loves sugars, carbohydrates. That's what it feeds on. It bloats your gut. It causes you to retain fluids. You gain a lot of weight. So first, let me say that there is nothing inherently wrong with the list of foods. Everyone enjoys a treat every now and then. However, if you find yourself eating these kinds of foods several times a week, much less every day or several times a day, then it definitely indicates big trouble. Let me show you this before and after picture, which doesn't lie. So with Candida, again, it bloats you, retain fluids, you retain a lot of adipose tissue because the body wants to surround the toxins you're ingesting with fat. And with a yeast infection, again, you're retaining a lot of fluids. Without Candida, you just lose all that extra weight after infection is gone because you don't have the inflammation and edema. So basically, that sweet tooth indicates a deeper underlying health problem like Candida albicans yeast infection overgrowth. So with exception of fruit, most of the items above are not even real foods. These are packaged, processed, refined, and lifeless. They have basically empty calories. They are loaded with sugar. If you are craving sugar, and if you eat these types of foods, then chances are high that you are feeding the yeasty beastie, okay? Let's see here. We already did the saliva test, and the third test is to check for Candida albicans. I have this 80 questionnaire list of symptoms, and the higher your symptoms are, the most likely we're confirming a Candida yeast infection. So this test is reviewing the signs and symptoms to determine if you have a Candida albicans infection overgrowth. Candida albicans yeast infection overgrowth, Candida overgrowth, CO symptoms are so numerous and seemingly unrelated that they can be confusing to both doctor and patient. The majority of people who have CO do not realize they have it until they become seriously ill. Why? Because Candida yeast not only steals nutrients from the food that you eat, it then poisons the tissues with waste material containing over 75 known toxins. Candida albicans is linked directly or indirectly to the following list of conditions and symptoms. A symptom is an outward sign that points to a deeper problem. So let's review the 80 likely symptoms listed below to see if any apply to you. Okay, so David, why don't you get a good view of that? Give yourself 1 point for each those you have had persistently for a month or longer, either currently or at any time in the past. So digestive problems, bad breath, yes, bloating, indigestion, diarrhea, constipation, intestinal pain, low blood sugar, food cravings, mouth or stomach ulcers, allergies to air or food sensitivities, heartburn, dry mouth, receding gums, hemorrhoids, irritable bowel, infertility, yeast. Again, a lot of these refer to women. Infection, menstrual, PMS. My wife marked the black ones, so that's not me. I'm marking the red ones. Bladder infections, endometrial. Obviously, these are all women. Iron deficiency, hormonal, no sex drive. Mental, emotional, dizziness, mental fog. antisocial behavior, suicidal tendencies, insomnia, depression, anxiety, irritability, skin and joint problems, skin rash, hives, dry skin itching, finger, toe, or foot fungus, athlete's foot, liver spots, water retention, joint pain, muscle aches, numbness, irritability, having to read the same thing twice, poor memory, where's my car keys, mood swings, headaches, lethargic, laziness, chronic fatigue, asthma, hay fever, colds and flu, puffy eyes, respiratory problems, chemical sensitivity, Epstein-Barr virus, which is chronic fatigue, adrenal thyroid failure, cold shaky, ear infections, chronic sore throat, postnasal drip, hair loss, stuffed sinus, sinusitis, overweight, diabetes, burning eyes, premature aging, autism. Okay, so I scored 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. Okay, so if you look at the score here, my IDA score is 24. Now 0 to 4 points indicates variations of normal living, unless persistent and severe. 5 to 9 indicates a clear pattern and shows likely development of CO dysbiosis. 10 or more indicates a strong pattern and almost certain Candida, overgrowth, dysbiosis, and I need attention immediately. So what am I going to do? This is going to be a surprise to you, but there is a solution. It's something you should be taking in a daily basis if you're ready to lose some weight, feel better, and get rid of your symptoms a natural way. So talk to me, come to my office, make an appointment about the Candida overgrowth protocol. I just call it the CO protocol, depending on how bad you are. We'll determine how much and how many supplements you need to overcome this condition, but there is a protocol. One thing is for sure. If you don't do anything, it's only going to get worse and make your life and how you feel worse. The choice is yours. Get on the program today and start feeling better tomorrow. Call my office, 714-636-2741, and then we'll schedule your candidiasis, your detox program, so the weight will just come off. Thank you for watching.